This show is sponsored by PowerfulWomenUSA.com. Hey, everybody, I'm Jill Conway, and this is Secrets of Powerful Women, a show dedicated to celebrating and supporting strong and successful women and sharing their stories. I'm hoping that you will be inspired to pursue your own dreams, reclaim your voice, and discover your strengths. So my guest today is Dr. Evelina Grayver. Evelina is a top cardiologist. She is director of the Women's Heart Program at Northwell Katz Institute for Women's Health, and she is president of the American Heart Association here on Long Island. Evelina, thank you for being here and welcome to the show.
Thank you so much for having me. This is incredibly exciting, actually.
You have done it all. Well, that's very nice of you, but you have done it all. And I've been wanting to have you on for, I think we've celebrated a year of anniversary for the show, but I think you're one of the first people I wanted to have on. So thank you. We finally made it work.
It's really been a while. Yes, my schedule's been insane.
Well, no, you're very busy. You're a very hardworking woman. So for everyone out there, I don't know if you could get an appointment with her, but you should, because she's pretty awesome. So
thank you.
So let's talk about, before we go into your story and everything, I wanted to talk about, obviously, you're a huge advocate for women's heart health. So at this point, I think I read something like the stats are going down for women who actually know how important heart disease is in their lives. It's like, and what's going on? Why is the message somehow getting lost?
Well, I think that it goes back to the fact that, let's start off with the social media and Hollywood, right? It has known the fact that, and I say this all the time, right? When a man clutches his chest, we all know the fact that that man is having a heart attack. When a woman clutches her chest, the assumption immediately she's either having a panic attack or some sort of a gastrointestinal discomfort, right? Unfortunately, it is still, despite, and listen, with the work that American Heart Association has done through the Go Red movement and everything else, there's been a significant change when it comes to the awareness of cardiovascular disease in women. But we're still nowhere close to as to where we need to be. Cardiovascular disease kills more women than all cancers combined, including breast cancer, lung cancer, and colon cancer. And somehow we know, the month of October is coming up right now, and we're all going to be wearing our pink ribbons, and we know what that actually means. We also know the fact that at a certain age, based upon our genetics and everything else, we're supposed to get an appropriate breast cancer screening. We're supposed to get that mammogram and potentially an ultrasound or something of that nature. But no one really knows when is an appropriate time to get in a cardiovascular evaluation. And should I wait until I have certain symptoms before I go to a cardiologist to be actually seen? So I think that between where we are from the social media and sort of the aspect of cardiovascular disease from Hollywood and everything else, to where we are at the moment in reference to, we don't have sort of the guidelines as of yet as to when should somebody see a cardiologist. That's where we kind of get lost. And to be honest with you, going back, and I know I don't mean to age myself at all at this point, but, when I went to medical school, and it seems like it was yesterday, I swear to you, it really paying the loan.
I believe you.
It does seem like it was yesterday, but there was really no significant sort of concentration on women's heart health, right? There was maybe a lesson or two in reference to the fact that women do present different and with atypical symptoms at times, but that really was it. They really did not go into an understanding. And a lot of it has to do with the fact that we don't have a lot of research to back it up, right? Majority of the research that we have right now, majority of the studies have all been extrapolated from, older white men into us, into women. And we're not just little men, right? That's the whole thing. So that data cannot be sort of extrapolated to sort of treat us as to what we need and everything else. Approach to women's health has always been kind of the bikini approach, right? Nanette Wenger, who's I believe is in her 90s at this period of time, who's sort of the matriarch of the birth of sort of the understanding of women's heart disease and everything else. She's a cardiologist. She came up with that terminology, so I can't say that it's mine. That in reference to the bikini approach to women's health, right? It was all a matter of sort of our breast and our reproductive organs, and that was it. We're not supposed to take care of anything else, nor do we really have anything else, right?
Mm, mm.
It's about sort of that old understanding, but we do know the fact that there's a lot more to our health overall, right? Than just that bikini approach to our care.
So I want to go back to something you just said. So age, when should someone get checked out?
So it's interesting, ready? So the way that I see, right, the way that would love to see women's heart health be taught in medical school is based upon their reproductive years. To be
Mm.
honest with you, I think the fact that women need to be seen in their sort of pre-reproductive years, okay, and that is because of things such as PCOS that could potentially lead to cardiometabolic syndromes and early issues cardiovascularly, then into sort of their reproductive years, getting appropriate preconception evaluation during the time of the pregnancy, postpartum, and everything else, right? And then post reproductive years, when we're getting to our perimenopausal and menopausal years. So, when you're asking me in reference to when should a woman really get evaluated, I believe the fact that a woman really should start getting evaluated early on in her teenage years, definitely after the point that she's 18 and over, definitely never waiting until she develops any symptoms, and especially knowing their genetics, right?
Mm.
So cardiovascular disease is kind of easy, right? I'll really sort of simplify it by the rule of 80-20, right? 80% of cardiovascular disease is preventable. 20% is genetic, right? We cannot run away from our genes. So knowing our family history is incredibly important, right? And like I said, you cannot run away from our genes, right? Having that predisposition, genetic predisposition, that should even force that woman to be evaluated early on in her lifetime, right? And the 80% preventability is huge. There's very few disease states out there that can be prevented 80% of the time, right?
Wow.
So when we're talking about preventing, we're talking about potentially decreasing the opportunity of developing things such as sort of what we consider to be kind of classic risk factors, right? The hypertension, which is high blood pressure, diabetes, high cholesterol, smoking, sedentary lifestyles, right? That kind of stuff is what's considered to be kind of traditional risk factors. And we have a lot of sort of non traditional risk factors. Some of them are actually gender specific risk factors,
Like
such,
what? Like what?
such as adverse pregnancy outcomes. And that's the one thing that really sort of kills me, to be honest with you, because maternal mortality is incredibly high in the United States. We lose more young mothers in their first year postpartum than most countries. And the most common reason for it is cardiovascular disease.
Wow. S Wow. So but why is that? I mean,
Mhm.
what is it about their heart? Like you mentioned earlier, like women should get, evaluated early before they become pregnant, but what exactly are you looking for? So what are the warning signs or something like that?
It's not in the warning signs. When women get pregnant, right? When women get pregnant, they're in their 20s, 30s now, and a little bit later, obviously in life and everything else. But it's the happiest time of their life,
Mm.
right? They're about to become moms, or they have kids and they have more kids and everything else. And their attention is elsewhere, right? And certain risks factors that were in the past completely overlooked, right, are now known to have lifelong cardiovascular risk, such as preeclampsia, such as gestational hypertension or blood pressure issues that develop during time of the pregnancy, gestational diabetes, right? And all
Mm.
of these things in the past were thought of just, it's fine, almost like Vegas, right? What happens in Vegas kind of stays in Vegas, right?
Right, right.
Or what happens in pregnancy kind of stays in pregnancy.
Mm.
That's not the case. We now know that these risk factors carry a lifelong cardiovascular risk. Those women that actually have these adverse pregnancy outcomes are at 4 times increased risk of developing high blood pressure at a much earlier age. They're twice at a higher risk of having a stroke and twice as high a risk of having an early heart attack. right? And then it's scary, right? Like they would think like, why in the world something that's just related to the pregnancy state, why
Mhm.
would that actually do that? And that's where sort of the research now comes in and everything else. And there's a lot of sort of theories out there, right? So are these mothers sort of have the underlying pathology and the pregnancy just tips them over, or
Mhm.
something happens during the time of the pregnancy within sort of the placenta and the vascularity there that kind of triggers it? It's hard to say, right? What comes first, the chicken or the egg kind of a scenario. But all we do know is these adverse pregnancy outcomes, like I mentioned. So it's preeclampsia, it's gestational hypertension, it's gestational diabetes, it's even spontaneous preterm delivery, okay, and intrauterine growth restrictions. So if somebody's baby is considered too small for their size or for their age, gestational age, that in itself is already a marker for early cardiovascular disease for that mom.
Wow. Well, what about preeclampsia? Like, how does that fit into everything? What is that first? Let's describe what that is.
So preeclampsia. So gestational hypertension, right, or I'll set off with that, is when a woman develops high blood pressure after the 20th week of her pregnancy, right?
Okay.
And then if at a certain period of time she starts to spill protein into her urine and starts to have issues such as seizures or potentially heart failure, that actually develops into preeclampsia. So it's high blood pressure, they develop symptoms, they start to spill protein into their urine, and that actually can lead to early onset cardiovascular disease. And no one in the past really thought about it. This really has been such a recent development, probably within the last, I would say, maybe 5 to 8 years, honestly,
Wow.
no longer than that, that we now sort of identify these women as such high risk women, and we try to capture them early on. And it's scary for them, right? Because some of
Mhm.
these are like 20-year-old girls that are sitting in my office and they have no clue in the world what are they doing there,
Mm.
why are they in the cardiologist's office. And then when I go through this whole explanation, they're shocked because all they want to do is pay attention to this newborn child, and now they have to deal with their own sort of health, their own mortality component and everything else. It becomes overwhelming significantly, you know?
So what are the symptoms then? What are the symptoms of, let's say, preeclampsia
Preeclampsia.
or yeah.
So preeclampsia comes in the form of a woman develops high blood pressure. She
Mhm.
starts to develop severe headaches,
Mhm.
blurry vision, weird halo spots, something along those lines, chest discomfort, even abdominal discomfort, like sort of a right upper quadrant discomfort, swelling not only of her feet and her legs, but even of her hands and of her face. So those are some of the symptoms that women present with, and that is imperative for them to immediately seek medical attention.
Yeah, but I think, right? I would have thought, and I think this is common where, you think, well, you get bloated when you get pregnant, right? You swell, like everything seems to swell, but this is different.
This is different, and you know what? This whole idea or of this is just pregnancy related, I don't
Yeah.
buy it anymore. We lose way too many young women, way too many young moms to actually have this poo-poo symptom of just, oh, this is just pregnancy, right? And a lot of family members do that, right? Where, I've seen it. A lot of young girls come in and they're short of breath, and like their own loved ones, like, oh, I've told her the fact that this is just pregnancy. I was like that too. And it gets kind of dismissed. What I'm trying to say is that because of these incredibly frightening, astonishing
Mhm.
numbers of the maternal mortality, where we are cardiovascular health wise with women overall, we can't continue dismissing any symptoms. We can't continue just saying this is just pregnancy related and everything else. Pregnancy related, to me, is a diagnosis of exclusion, meaning you've excluded everything else. Meaning, if the woman is having shortness of breath, or palpitations, or some chest discomfort during the time of the pregnancy, or swelling, and everybody in the world is telling her this is nothing, that this is just pregnancy related. No, do not, do not take that as the answer. Come in, get an appropriate evaluation, and even if your own OBGYN, because again, there's a little bit of that delay, right, in
Mhm.
understanding this whole concept of everything else. So even if your own OBGYN feels like, oh, this is nothing, find someone that will listen. And that's
Mm,
the most important thing, is that unfortunately at this time, women have to be their own advocates.
wow. So what happens then? So if you know you have this condition, what happens during the course of your pregnancy? Does the care change? Or yeah, what
100%.
happens?
So the care changes. You become considered to be a high risk pregnancy. You get monitored a lot closer. Even you might actually be delivered significantly sooner. Okay. Whereas, I know the fact that the old school mentality was just, let them go as far as possible, let them stay pregnant as much as possible, and everything else. The
Right.
longer the baby's in there, the better it is. That's not the case with any of these disorders. At this period of time, if anybody has any evidence of gestational hypertension or any evidence of preeclampsia, they will deliver them earlier, probably closer to 37th week of gestational age at this period of time. They get seen by a cardio obstetric specialist like myself, where we monitor them closely. If they've had history of preeclampsia in their prior pregnancies and they get pregnant again, we actually put them on aspirin at week 12 of their pregnancy to try to decrease the chances of having a recurrence, right? So there's the care changes significantly.
So what exactly is it though with a preeclampsia? It's the heart muscle or is it something in the womb? Like
It's hard to say. So it's really, they think the fact that it's almost like a failed stress test, right?
oh,
A pregnancy really is like a stress test in the woman's
mm,
body.
mm,
Even before the woman actually realizes the fact that she's pregnant, right? Week 2 or 4 after she's missed her period, the cardiac hemodynamics change significantly. Significantly. Your overall heart rate starts to go up. Your cardiac output, which is how hard the heart is working, starts to increase. By week 12 of pregnancy, right? This is towards just barely towards the end of your first trimester. Your cardiac output, how hard the heart is working, almost doubles, right? We go from pumping anywhere between 3 to 5 liters per minute to pumping almost about 8 to 10 liters per minute.
wow. Wow.
So it really is a stress test. Now, if anybody has had a stress test lasts no more than 10 to 12 minutes,
Mm,
right? That's
mhm,
it. Pregnancy, God willing, lasts anywhere close to 9 months, right?
mhm.
9 to 10 months. So that is a continuous stress on the woman's body. So what actually happens, is it the vessels or the heart or the inflammatory response? I think it's a combination of both. I think some of these women have underlying predisposition, maybe for early onset high blood pressure or early onset cardiovascular disease. Maybe there is some genetic predisposition and everything else. And then the pregnancy just literally pushes them over the edge, you
Wow.
know?
Wow.
And then in the past, they were overlooked. They were just dismissed until later on in life. And then all of a sudden, these 40 or 50-year-old women are coming in with early onset heart disease, and no one knew why.
Oh my goodness. All right, so let's fast forward to a 40, 50-year-old woman, okay? So what are they showing? What are the symptoms that they are showing now?
So when it comes to cardiovascular disease and women, they do present atypically, right? They won't, very few will have that elephant sitting on their chest as the textbooks would describe, right? They may have chest tightness that they won't describe as chest pain. And that's incredibly important, is that how you actually ask, the verbiage that you actually use with women, right? So they might not have the chest pain, but they will have chest tightness. They may say that, you know what, doctor, this is nothing. My barrage has been just a little too tight.
Sure.
You know, they might have some nausea, and more sort of like an upper GI upset kind of a thing. They might say the fact that this is my reflux just beginning to work up a little bit. They may have sweating, fatigue. But it's interesting, because if you ask women, majority of us are tired. Majority of
Right.
us chronically really fatigued, right?
Right.
And how do you know? How do you know the difference between your usual fatigue
Right.
versus this is something more? And this is where I guess it's so important to actually be very much in tune with your body and understanding, you know what, something isn't right, and I have to seek appropriate medical care. And if my symptoms are being dismissed, then I go elsewhere. I think that's the most important thing.
I think that's the hardest thing for people to do, right? Because they like the doctor, they trust the doctor.
100%.
Yeah.
But I think that we have to recognize the fact that we like our doctor, we trust our doctor, but at the same time, we kind of have to trust our own gut, our own understanding that something is not right and prioritize ourselves, right?
Mm,
Women are not really good at that, right?
mm,
To the point where actually, there was a study, sort of an observational study that was done not that long ago, where it shows sort of where women's priorities lie, and it's actually pretty funny because it's like it's family, it's laundry, it's husband, it's pet. No, wait, the pet actually came above the husband.
I'm guilty of that too, I think sometimes.
That is actually above the husband, and then it's themselves, right? So the whole idea of putting ourselves first is such
Mm,
a almost as if we're being selfish. It's like we always talk about self-care is not selfish and everything else, but prioritizing ourselves, when especially when it comes to our medical care, is the farthest thing from being selfish.
Well, but I feel like culturally we're taught that.
I am guilty of
Yeah.
it
Yeah.
culturally, and how
Yeah.
we raised and everything else. Yes, we're not allowed to. Again, like culturally, I am supposed to take care of my child first, my family first. I am very blessed because I am sort of in that sandwich generation where I'm blessed to have my grandmother, I have my parents, I have my child. So I'm like squished in between all, and I'm supposed to take care of everyone. And if I
Mm,
don't prioritize myself, I'm an egoist.
yeah. But it's funny when I first heard you speak, I guess I don't know if it was the beginning of this year, and you spoke about that and it really resonated with me because I feel like we're all guilty of it, right? We're all put ourselves last. We're made to not everybody, but we're made to feel that that's the way it should be done. I know my mom she's alive, so she's just turned 90, but
God
she's
bless.
always says, "Well, you're a mom. That's the way it goes. You have to put everyone else first. You have to, we have to be everyone. We have to keep the house nice. We have to be there to take the kids everywhere to every sport. It's just like we have to be in the PTA. We have to everywhere and then taking care of everyone else, sisters, brothers, husbands. It's just, I don't think we can do it all without help.
But we shouldn't, right? We
Right.
shouldn't. Like this whole idea of doing it all, having it all, and everything else. It doesn't. I don't know when did that came about, right?
Mm,
I think this whole idea. Listen, I think that being a mother has been my greatest achievement, truly my greatest accomplishment in life, period.
me too.
Hands down, right? No matter
Mhm.
what my accolades say or anything else, that has been my greatest. But I recognize the fact that if I do not take care of myself, and again, I am guilty of it 100%. So I don't want to sound like a hypocrite of any
Mm,
kind at all.
mhm.
I'm truly guilty of it. But I also recognize the fact that if I don't take care of myself, there will be no one here to do the laundry or to take the care of the house or to be the mother or the daughter and the granddaughter and the sister and everything else. Like, so at certain times, like I'm learning the very hard way.
Mm,
I've had to just allow myself a little leeway to just do what I need to do and see the doctors that I need to see. And time flies, right? Time really, really flies.
mm.
So it was interesting. I just recently went to an OBGYN with my daughter, right? And I said, you know what? I'm taking her. I should make my own appointment too, because I think I'm sure I'm due for my annual or something of that nature. I was there 5 years ago.
Wow.
5 years ago.
Right. Shocking, right?
It just and my OB/GYN was just like, "Thank God that your daughter made an appointment for herself and dragged you in here because it's been 5 years." Jill,
Wow.
I literally I'm like, "No, impossible. I was
Right.
here." She's like, "Nope, 5 years."
I always say that. I'm like, but I thought I was just here, like really, like last year. Like, how did it just goes so
It
quick?
does. It
Yeah.
it goes really, really quickly, and the busier that you are, the
Mm,
quicker the time goes.
mm. Let me ask you, because I want to talk about that. We'll talk about that in the second half when we talk
Mhm,
about you and work life balance and stuff, because I think that's important because
mhm.
you seem like a very high achieving, Um, you've worked very hard in life to achieve everything you have. So I want to talk about that. But as far as like, and this might seem like a silly question, but I'm going to ask it anyway.
Oh,
Women's heart and men's hearts, are are they built differently?
yes.
Oh, okay. I did
Yes, they
not
are.
expect that. Okay.
They are. And that is something that is also not particularly taught in early on in medical school. They are different. So there are small differences, meaning how are they different? So how are they similar? Let's start off with that.
Mhm.
We all have four chambers in the heart. We all have four valves that separate those four chambers and everything else. But our chamber sizes are different.
Mm.
Our pliability, how they sort of get squeezed and how they relax, is different. The effect of inflammation on our vessels is different. Our vessel caliber, the caliber of our vessels is smaller
Meaning
than,
what? What does that mean?
meaning like the circumference. The
Oh,
circumference of our blood vessels is significantly smaller than it is of men. The vessels themselves, the circumference, right, the outer layer and everything else gets easily calcified, right? For women. So women have more, like they have smaller calibers or smaller circumference vessels that are hardened. And it's a huge difference, right? We also get affected by certain disease states differently.
mm,
Okay. So for example, such as simple as heart failure, right? I know heart failure is not really simple, but as a common diagnosis as heart failure can be, right?
right.
So heart failure by everybody or by the common layperson is somebody that has a weak heart and fills up with fluid. That's kind of like by the sort of the common understanding of what heart
Yeah.
failure is. But heart failure for men and heart failure for women is totally different. Heart failure for men is a matter of having a weakened heart, right? Heart failure for women is not that. It's not having a weakened heart. It's actually having a stiffer heart. So a heart is supposed to be able to do two things, right? It's supposed to be able to relax well and squeeze well, right? Relax well to get that oxygenated blood from from the lungs, and then squeeze well to then expel all of that well oxygenated blood to the rest of the body, right?
Mm.
So when it comes to heart failure, men are affected to the point where it affects their squeezing ability, so the heart becomes weaker, right? And oh, women, it's a difference. It becomes stiffer. They get like these stiff ventricles, stiff chambers of the heart that can't really relax. So there's a tremendous amount of difference from physiology to pathophysiology, that is not something that is always talked about or
Mm.
taught and everything else, and only is now truly begins to be researched.
So then that is why then the male feels like a elephant on his chest, like you said, and
Yeah.
then women don't.
The symptoms, it's so hard to really correlate in reference to the symptoms and how they feel and how it actually subsequently exacerbates. It's and the way that actually we respond to it, right?
Mm.
Men respond much quicker to their symptoms than women do.
Mm.
That even if Jill, for whatever reason, a woman does have more or less typical symptoms, she will dismiss them. And then what happens, cardiology is easy. Time equals muscle. The longer you're sitting on a closed vessel, the more muscle you're losing, right? So a
Right.
man responds pretty quickly,
Mm.
right? Especially a married man. Thank God because of their wives. They actually have shown the fact that married men live longer because of their wives.
That's the part.
Not
Yeah.
surprising,
Right.
correct? Right? They are actually they seek medical care significantly quicker than women do. Women, despite their symptoms, okay, will want to make sure the fact that the lunch is ready for tomorrow, that the laundry has been put away first, and everything else. And so that by the time they actually seek medical attention, they're in a much worse state than they would be if they. So there's tremendous amount of pathology, and that's why when we talk about why haven't we made much strides in the way of really helping, cardiovascular disease for women and everything else. There's so much. There's so much from the cultural, the way that we were raised, the way that we've been taught from medical school. And there's a significant amount of bias.
Mm.
Again, even from some of my older colleagues where they have a lot of female patients, um, they get dismissed. One of my really an incredibly memorable patient of mine who came to me at this point, we just celebrated our 10-year anniversary. She came to me about 10 years ago, and visually you would never think the fact that this is somebody that has cardiovascular disease, right? Because when you think of cardiovascular disease, you think of somebody who is really not very mobile, pretty sedentary, who's a
Mhm.
smoker, obese, something of that nature, right? No, I had this beautiful woman who's like literally like a picture perfect yogini, small, tiny, wonderful, active, the whole nine yards. And she's seen some of the top cardiologists from the city to like literally all the way down up and down the northeast coast. And somewhere within like the Russian community mentioned that like you have to go see Dr. Graver. So she comes to see me, and I come in, and I'm very casual at work, and she's like, "Who in the world is this kid that just walked in here?" Because I ran in there like with my Converse sneakers and everything else. Um,
You're real. You're a real everyday woman. That's what's awesome. Go ahead. Sorry. So you ran in there.
So I went in there and I look at her EKG, and it was significantly abnormal.
Mhm.
Significantly abnormal. Now, this is an educated woman. She's a dentist, so she's gone through. She understands herself. But for years, she's been convinced the fact that this discomfort that she feels, okay, that goes into her jawline, was just nothing but anxiety, to the point where they've sent her to psychiatrists and they wanted her to put her on antidepressants and anti-anxiety meds and everything else. But she herself knew that something wasn't right, right? So I looked at the EKG. The EKG is abnormal. And I said, I think that you're going to end up with a cardiac angiogram. And she's like, how do
Mhm.
I just go from cardiologist that told me the fact that this is not even cardiac to you telling me the fact that it's an angiogram? There has to be
Yeah.
something in between. And I said, there are a lot of tests that we can do in between. But based upon what I'm seeing and the story that you're telling me, I have a feeling you're going to end up with a cardiac angiogram. She did not want to be so hasty. And I understood that. And that's the other thing is the matter of just really feeling your patients out and seeing how they respond to certain things. So we went down the route of doing a cardiac CAT scan first. And I remember after getting that CAT scan back and seeing how abnormal that cardiac CAT scan was, I called her on the phone, and her husband picked up the phone. And he said, "We're actually away on vacation. Is this something that could actually wait until we're back? Or do you think the fact that we should be rushing back now?" I said, "Well, let's do this. Why don't you start her on aspirin? Let's start there. And then as soon as you come back, she needs to be scheduled for an angiogram." So we started her on an aspirin. She came back a week later. She had an angiogram, and she had calcification and blockages in all three of her arteries, every single one of them. And while on the table for the angiogram, I immediately ran to get a cardiothoracic surgeon because somebody that has severe triple vessel disease should be evaluated for an open heart surgery. Her vessels were so calcified and so diseased all throughout that the cardiothoracic surgeon said that she is not a candidate for surgery. Now, she was barely 50 somewhat years old.
Wow.
Okay. And she ended up with staying in the hospital for 2 or 3 days. I don't recall its moment, getting stents all throughout all three of her vessels. Okay. Because again, she's had underlying issues that were dismissed for a very long period of time.
Wow. I was gonna say, how do you prevent that? Right.
Well,
'Cause
here comes that, right, that 80-20 rule that I told you about, right? She had underlying genetic predisposition, right? Her father and her mother both developed cardiovascular disease at a younger age. She has been dealing with high cholesterol issues, and she's somebody who is like very much into natural remedies and everything else. And honestly, like so am I.
Mhm.
I love preventative natural approaches that are out there, and I think that I learn about them more and more with every single day. But at a certain period of time, when we go from actually preventative route to actually having diagnosed disease, we have to be able to shift from that natural approach to actually evidence-based medicine, right? And I think that she had a hard time with that transition, okay? And really also between having the genetic component, having some preventable risk factors, stress, right? Women don't even recognize, we always talk about stress being the silent killer or high blood pressure being the silent killer, and sort of stress is kind of under the stress is the silent killer. Okay. We don't recognize it, especially women of sort of, that are high ambitious. And, when we talk about secret of powerful women,
Hmm.
secret of powerful women is really being able to sort of come on the show like this, right? Present what we know, right?
Hmm.
Having sort of that phase, the confidence and everything else. Okay. But there's so much inflammation that happens that we don't address appropriately. And stress does that. Stress is the inflammation that is caused, cortisol shifts and the hormone shifts and everything else. It's all over the place. So
Hmm.
yeah, it stress through family and everything else, her underlying genetic component, some preventable risk factors, and here we were. I mean, thank God we literally just celebrated our 10-year anniversary with her, and she's doing phenomenally. But when I think of that typical woman patient, she always comes.
Hmm.
Mind.
There's so much to talk about there, but I want to talk about before we go to the commercial break because we touched base on it. Midlife and certainly perimenopause, menopause, postmenopause, hot
Mhm.
flashes, and things. All the changes that a woman goes through. How do you know if you're having, your hot flash and you're sweating, or you're having some sort of cardiac issue going on?
First and foremost, again, before it becomes a hot flash, it becomes it's just perimenopause or menopause, similar to the way that it's pregnancy. Like when I said, like, with pregnancy, right? It's not just because it's pregnancy. So you can't say and can't dismiss it as just being perimenopause or menopause until you get the appropriate cardiovascular workup. Right. A lot of women during perimenopause and menopause have a lot of palpitations, right? And they think the fact that it's just anxiety or depression or whatever that could be. It could be actually arrhythmias, right? So I think that before we dismiss any of those symptoms and we put a diagnosis of exclusion, such as perimenopause or menopause, a true evaluation has to be done. Cardiologist to be able to see that patient, appropriate blood work has to be done, appropriate testing has to be done. And then if it turns out to be that there's nothing cardiovascular going on, then maybe that's a good transition for that woman to have a discussion with her GYN about starting hormonal therapy, right?
Mm.
I know it was like the biggest taboo forever and everything, right? But we now know the fact that a lot of those women actually, do benefit from that hormonal support at this period of time. And a lot of the changes that happen within perimenopause and menopause years do increase our risk of cardiovascular disease, right? So when we go through our perimenopause and menopause and we lose that estradiol support and we lose that progesterone support, our blood pressure starts to creep up, right? Our cholesterol starts to creep up. Our glucose control that supposedly we've never had an issue with starts to creep up. And we develop what's called a cardiometabolic syndrome. Now, early on in the program, I mentioned of that PCOS,
Mhm.
polycystic ovarian syndrome that some of the young girls have increases their risk of developing cardiometabolic syndrome. It's the exact same thing that happens within our perimenopausal and menopausal years, right? And that cardiometabolic syndrome, when our blood pressure starts to creep up, when the cholesterol starts to go up, and the sugar intolerance starts to go up, and everything else, that's when we get into trouble. That's when we also get that central obesity, right? Like that tire, like that menopause tire that women always complain about and can't lose and everything else, right? That's the adipose tissue that is hormonally driven and incredible risk for cardiovascular disease.
Wow. So it's the trifecta. Trifecta. Can
Mhm.
you have high blood pressure without high cholesterol and still have heart disease?
Yes, yes.
Oh,
You don't need to have all of it, right? So it's not an all inclusive. It's not hypertension and high cholesterol
okay.
and diabetes equals cardiovascular disease. It could be hypertension and or cholesterol and or diabetes that lead to cardiovascular disease.
Wow. Oh my gosh. All right. So let's take wow, this is a lot. It's just so no, because it's so interesting and that's when I like when people ask me what's the secret of a powerful woman, it's like education. It's sharing the education so people can learn from someone else. That's it. That's it, everybody. Because that's the only way we learn. We've pulled away from the times of our ancient ancestors where everyone gathered around, the campfire and told their stories and
We
shared
need
vital information.
to get back to the campfires.
Yeah, I think so. I
We
think
need to
so.
get back to the campfires.
All right, so let's pause here. We're going to come back with Dr. Evelina Grayver after the commercial break. You are listening to Secrets of Powerful Women. We'll be back. Hi, everybody. I'm Jill Conway. If you love what you're listening to, please like and subscribe to my channel on whatever podcast platform you listen to and on YouTube so I can keep bringing you these amazing women and sharing their stories. Thank you so much for listening. I hope you love it as much as I do. All right, welcome back, everybody. You're listening to Secrets of Powerful Women. Dr. Evelina Grayver is with me. All right, so Evelina, let's talk about you know, growing up. You were not born in the US. Tell us about your childhood and how medicine came about. But we're tell us about. Let's go back to the young girl that you were. The
Okay. You mean I'm not that anymore?
Yes, you are. But you know what I'm saying. The infant.
Including me, yes. So not born in the United States, born in the former USSR. Um, Phenomenal childhood when you think about like what childhood really is about, and very very simple childhood. It was all a matter of just running outside until I hear my grandparents or my parents screaming my name to come inside. Um, and my parents by those standards were considered to do very well for themselves. My mom was a musician. She's a classical pianist. My father was an engineer, and we were happy. I begged and pleaded for a sibling. They finally gave me my brother when I was about 8 years old, so I became a mom literally at the age of 8 because I wanted no one to come near him except for me. um and my parents initially my whole family was planning on immigrating probably even before I was born, like around 77, 78. And they were denied immigration because my father served in the Russian Navy in the submarine. So during that Cold War period and everything
Mm,
else, they were denied immigration. And we, and a lot of my family actually left to Israel at that period of time, and then a lot of us stayed behind. So in 1988, I was in school, and I mentioned something along the lines of potentially my family was thinking potentially immigrating. At that period of time, only Jewish families were immigrating. And at that time, some of my classmates that I thought they were my friends, um, actually chased me home, throwing rocks at me, cursing at me because I was Jewish. That day, for some miracle, my father was home. He saw me as I ran home, and that was the decision to say that, you know what, we have to leave. And the following day, we started the immigration process. The immigration process at that time was not incredibly easy. It wasn't just a matter of getting the ticket and off we go. It was truly an immigration process. My parents had to give up all of their rights and everything else when it comes to former USSR. And the first part of the immigration is that went to Vienna, Austria. That's where we were sent first. As we were leaving former USSR, they actually ended up taking my mom's wedding band because they thought that she was taking too much gold out of USSR. Yeah, and we left with literally nothing. When people talk about like immigrants leaving with nothing, we were that.
mm,
And it was 10 of us. It was me, my brother, my parents, my grandparents, my aunt, uncle, and my cousins. We went to Vienna. We lived in Vienna for about a month. And as a kid, when you're going with your cousins and your family and you think this is the greatest thing ever, but when I think about it now, like there was 10 of us in a one-bedroom apartment, barely a one-bedroom. I don't even know if it was a one-bedroom. And then from that point on, we were sent to Italy. And lived in Italy for about like 4 or 5 months. And I know it sounds very glamorous when people go to Italy and everything else. It wasn't glamorous. We were initially put up into a small little motel, not a hotel, like a motel, little like a roach motel, somewhere in Rome. Um, and again, the 10 of us were spread amongst two small, very little rooms. There was really and nowhere to even like get like hot water. My parents would have to boil water with like that thing that still don't know what they're called, like where they drop this thing to boil. It's an electric thing that you plug it in. No
Oh,
idea.
yeah. Yeah, yeah, yeah. I know what you mean.
And so and then my dad and my aunt were able to find us small little apartments. We had no money, so they find small little jobs to do here and there, to maintain sort of our ability to stay there. And after getting physicals and getting the a someone who's going to be a sponsor for you here in the United States, and we had an uncle that was in the United States at that period of time. He had to sign off, literally, pretty much his life, that if we come here and if we're not paying taxes and everything else, they will come after him and blah blah blah. And then we came here, and that was February 9th, 1989. Um, and that's how our life started. We lived in Queens. Literally, much of my parents are still there. My grandmother is still there. Um, and my parents, who, as I said, my dad was an engineer, my mom was a musician, they immediately told her the fact that if they ever want to be able to feed their children and educate their children, that they need to do something immediately and forget about their professions and everything else. And my mom, who was really a well-known classical pianist in Ukraine, started working at bagel shops. And she opened up a bagel shop every morning at 4 o'clock in the morning to start making bagels, while at the same time in the evenings going to school for computer programming and medical billing. My father started learning maps of New York City and started driving the yellow cab. And that's how we started. That's how we started here in the United States. My parents' biggest belief was always educating the children. That was like we're the future, and this is a land of opportunity. As long as you work hard and study well, you'll be successful. And
Yeah.
that was their secret of success. It's education, really, by far.
Wow. So how
They
did medicine come about to you? Did you always at what point did
Yes.
you say to yourself, "I wanna be a doctor"?
So there's a picture that my father found, and I can actually show it to you, that someone took when I was in daycare back in Russia, back in USSR, where I wanted to help and to fix all of my friends' toys. And I knew that I would be able to do so. And I remembered this. Like I think I was about 4 or 5 years old. I lined them all up in the line like that. I had them all sit. I put like a little like a hanky on my head because I thought that that's what doctors are supposed to do. I put a hanky on my head. I had them all lined up, and someone took a picture of it. My dad found it as I graduated medical school, who blew it up and entitled it First Line at Dr. Grayver's office.
Oh, that's
So
wonderful.
I don't know how in the world or why in the world I thought the fact that I should be a doctor. I want to be a doctor. I do not have any physicians in my family at that period of time, but that's all I ever wanted to do. I don't remember even honestly contemplating of another profession.
Wow, so you knew even through high school, through everything. Wow.
Always. I genuinely never even considered another profession.
Because you felt a calling. What is it, what does it mean to you to do this
It's
or
the
what
need to help. It's the need to help. It's the need to be, I guess, needed. Like, even if I know the fact that maybe I can't help with that, but I will find a way to do so anyway.
Mhm.
Um, it's I guess in the weird way, I kind of have a sixth sense about patients' feelings and everything else on the meaning that what's beyond as to what presents to me in the physical form.
Mhm.
Um, I just always wanted to be, I guess, needed and
Mhm.
always wanted to help.
Oh my goodness. So how then did you, I mean, you mentioned it a little bit, but
Mhm.
how the route to women's heart health, um, ha
It
do
was
you
it
yeah,
was
how did you get there?
it was actually a very interesting and actually a little bit on the painful side route, to be honest with you. So when I went to medical school, I really thought the fact that I was gonna go in the world of surgery, something more um, invasive component and everything
Mhm.
else. And then my father got sick during the time I was in college with cardiovascular disease and everything else, and I became fascinated with it. So I went into medical school, did my residency, then did my subspecialty training fellowship in cardiology, and then when I finished my cardiology fellowship, I was immediately hired as the director of the cardiac intensive care unit, taking care of the sickest cardiac patients that would walk through the door of the hospital, right? Those patients with cardiac arrests, fatal arrhythmias. They called me an adrenaline junkie, right? Because I would be running to every single code that was ever in the hospital because I knew the fact that I would be able to help. Now, fast forward to March 2020 when COVID hit. At that period of time, I was the cardiac intensive care unit director for the last 8 years.
Mhm.
And because of my sort of knowledge in both critical care, medicine, and cardiology, I was one of the first ones to be deployed into COVID ICUs. Um, I lived in COVID ICUs for months. And I was there for a little too long, and they brought me back into the world of cardiology. 6 months, I was redeployed finally back into
Mm.
my profession. Um, those 6 months were probably the scariest, the worst of my both personal and professional life. Um, I barely got to see my daughter. I almost lost my parents who were sick right off the bat in March of 2020 when things were really, really bad. I did end up losing my grandfather in April of 2020 in
I'm
my
sorry.
unit where I had to take him off of life support. So
Oh my goodness.
yeah,
Ugh.
it was a turmoil, like really.
Mm. Mm.
And then when I came back, I was aware enough of myself to know the fact that I was burnt out, like physically, mentally, emotionally, intellectually, I was just at nil.
Yeah,
True,
you had nothing left. You had nothing left to give. Yeah.
absolutely nothing left. And I sat with my chairman of the department, and I told him that there's no possible way that I can go back to being the director of the cardiac intensive care unit and work in the intensive care the way that I worked prior to COVID. Because, I mean, I was the poster child of PTSD. I couldn't hear the sound of the ventilators. I couldn't bring myself to even the thought of putting on another N95 or any kind of mask. It
Mm.
was really difficult. And I said the fact that all I really wanted at that time is to really pursue my passion, which was women's heart disease and especially cardiobstetrics, especially taking care of these young moms that either wanted to get pregnant and they had heart disease or developed cardiac issues during the time of the pregnancy. Like, we did not have a system of appropriately taking care of those women. And September 2020 is when we launched the cardiobstetrics program, and it's now one of the fastest growing programs for Northwell. We get anywhere between 50 to 60 new referrals per week into the
Wow.
program.
Wow.
And it's not because of the fact that I opened something that was just not, it was just the need was always there, right? It's just a matter of appropriately triaging these patients, seeing them, getting them that appropriate care and everything else. And that's how I came up to, for the Women's Heart program, but it definitely was not an easy route.
Mm. So now, I mean, so you've mentioned one of the patients that stick with you and things like that. Where do you see like women's health, heart health going? What direction? Is it going in a positive direction?
It
Are
is.
we
It
Yeah.
is. It's going because of people like you that give people like me a voice and an opportunity to really bring others and to bring that knowledge out, bring the awareness to it. And I think that with the American Heart Association and the Go Red movement that comes in February, so similar to the way like we wear pink ribbons in October,
Mm.
come February, we all wear red dresses and I try to scream from mountaintops about the importance of, awareness of cardiovascular disease and women's heart health and everything else. So it's, you know, the research right now, there's a lot more research that is leaning more towards women's heart disease. We have new guidelines. Actually, the most recent guidelines from the European Society of Cardiology just came out in reference to appropriate cardiovascular treatment for pregnant women.
Huh.
So we're definitely going in the right direction. We just need to keep up the
Keep
loud
up.
voices,
Yeah.
and you just need to keep up with the work and spread the awareness, spread the word, spread the research, and hope the fact that enough women hear us, honestly, and advocate for themselves.
Yeah, yeah. I wanna talk about, because I find this very interesting, the mind-body connection, the mind-heart connection,
Mhm.
and, what do you see in that? Is there, for example, can you die of a broken heart? Things
Yes,
like that. You can,
there's actually a disease called a broken heart syndrome.
which is what?
It's called Takotsubo syndrome. So Takotsubo's, I know. Taka- Try to spell that one.
Yeah, no, yeah, no, go ahead. Go ahead.
So Takotsubo syndrome is known as the broken heart syndrome. What is it? So Takotsubo really is a Japanese terminology for an octopus trap. And the reason for the terminology is because that's what the heart looks like on the sonogram, on the echocardiogram. While when a woman or even a man at times presents with a broken heart syndrome.
Huh.
So what is it? So it is an overwhelming emotional state, and they've actually noted it specifically for women after they have a loss of someone or a significant emotional event and they start to have cardiac symptoms. They come in, they have an abnormal EKG. They could actually have abnormal cardiac enzymes, which is the enzymes that are released into the bloodstream during the
Mm,
time of a heart attack. And everybody thinks that they have a heart attack and they immediately rush them for a cardiac angiogram to see if they have a significant blockage, but they don't have a single blockage. Their cardiac vessels are completely normal, nothing going on. Then they do an immediate sonogram of the heart and the way that the heart looks, it almost looks like it's like a ballooned out completely and barely squeezing. And that's why it's called Takatsubo because that's, I guess, what the octopus trap looks like. Okay. And it is known as broken heart syndrome. They
wow.
think the fact that during the time of whatever emotional event that transpires, whatever endorphins, hormones that are released, catecholamines that are released during that time significantly affect the heart muscle. And it literally just goes into like almost like a stunning mode. Like and it's pretty scary. Pretty
Wow.
scary. So, and the syndrome, it's one of those things that it's like almost a law of 30, of one third. So a third of them get better, a third of them stay the same, a third of them get worse. Majority of them can have significant heart failure, can have fatal arrhythmias and die.
Oh my gosh. So
So
your mind can play your mindset can play a significant role in in your
cardiovascular.
health?
Yes, yes. Your mind, you know, when Well, they always talk about potentially decreasing negative thoughts or
Mhm.
decreasing that stress or and everything else. And it's a lot more than just what it does to us mentally for our mind's sake, but what it does to us physiologically. And that is the inflammation that takes place during the time of that mind body connection, right? The inflammatory cascade that takes place that potentially can cause a small piece of plaque rupture. Whether or not it's in our carotid arteries, it can cause a stroke, or potentially our coronary arteries and significantly cause a heart attack. So that inflammation, and inflammation is really sort of the the foundation of so many ailments, so many
Mm.
ailments. And when our minds are in that state of mind where we are spiraling and when we are just negatively affected by whether or not it's an event or so many other things, we can negatively affect our bodies. Yes. And then it goes really, it becomes like a almost like a broken loop at that period of time. And that's why it's so important to be able to have the necessary tools to break that in one way or another, to break
Mm.
that cycle.
So then, obviously, inflammation, stress, chronic stress, I would think is a horrible thing for all systems of the body. Certainly, like you mentioned, the heart.
Mhm. Mhm.
But so for you, let's just say personally, how do you deal with, as we mentioned earlier, that work life balance where there is stress? Like you know, we
So
you.
I despise I don't like, and I try my absolute best not to sound like a hypocrite, right? Because I can sit here and I can say the fact that you have to eat well and drink enough and do all of these things,
Right.
but I'll tell you, there's a lot of things that I do right, but there's a lot of stuff that I do wrong.
You're
So,
human. You're human, right?
yes, thank you.
Yes.
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 So what do I think that I do right? I do exercise. Sometimes I exercise too much. Okay. I do know that. Everybody talks potentially about taking that rest day. I don't particularly take much of a rest day because to me, exercise sometimes it's more of a mental release than
Mhm.
actually sometimes physically, to be honest.
Mhm. Sure.
So
Meditative. I mean, I say that too. I get on the treadmill sometimes and
it is meditative, and I know that you
yeah,
were a runner before. I'm
yeah.
a runner. To me, it's almost like getting into some sort of a meditative state, right? Because meditation is about
Mhm.
breathing, right? A lot of it
Right.
is breath work and everything else. And when you are a runner and when you know how to breathe, that becomes a form of meditation for me,
Right.
right? So I do exercise. I try my hardest to really eat right to the best of my ability. Again, like you said, I am human.
Mm.
I don't think that I sleep enough. Actually, I know the fact that I don't sleep enough, and sleep is imperative, right? I know the fact that I don't drink enough and I don't keep myself well hydrated. So that's also a big thing. I stay away from alcohol. I'm not even much of a social drinker. I never did any drugs. Some consider me Miss Goody Two Shoes and everything else. I'm not a Miss Goody Two Shoes. Like I do know how to have fun. Like all I've ever
Right.
needed to have fun is, my family, my friends, and good music, and I
Mhm.
was good to go.
Mhm.
Um,
I'm the same way. Do you know that? I've
yes,
never been one for I never understood, and I've said it now, and again, I can only imagine what people are gonna say, but and I tell my kids, "You don't have to drink to go out and have a good time."
yeah, yeah,
Right?
I
Like
completely agree, and maybe part of it has to do with the fact that I've always been sort of like a little bit of a OCD control person. Always wanted to stay
mhm.
in control and everything else. Like I went away to college, and used to look at some of these girls that were like falling over themselves, and I'm like, what are they
Mm.
doing? Like, why are they doing this? Like, you know.
Right.
So I again, maybe a social drink to relax is not a bad deal and everything, but it's just not something that I am.
It's not for
Um,
you.
it's
It's
not
not
for
for
me.
you.
It's
Yeah.
not for. But I do like socialization. Like for me, being able to sit down and spend time with my loved ones, with my family, with my good friends. To me, that is therapy.
Mhm.
So having that social circle, trying to really not isolate yourself as much as possible is very important. I mean, they always say that, like solitary confinement is probably one of the worst forms of punishment, right? So I
Although I like it, so I don't know, I think I'm different that way.
No, no, I think but to a degree, right? I mean, I
Right,
like
right.
it. I enjoy it too at times, right? I
Yeah.
enjoy having my alone time with my book. I don't meditate, but I do like to journal.
Mhm.
Uh, it only something that came out during actually COVID time. So talking about some positive things that came out during COVID. I was a horrible writer my whole entire life. Really, no joke. I
Mhm.
was always a math and science kid. My best friend, and I can admit this now that I'm this way into my life at this point. My best friend has written my personal statement to college, to medical school, and really, but I did all of her math homework, and so
It was a team effort. It was a team effort.
definitely a team effort. But during COVID, I felt like I it was almost like, I would come home to my daughter. I didn't want to scare her by telling her what I saw and
Mm.
everything else. And I had like a knot in my throat, like really, like I felt like it would choke me. And then I started writing things down, and it was almost like verbal
A
diarrhea for say,
release.
you know what I
A
mean? Like
release, yeah.
really a release. And that's when I started to write.
Mhm.
And I still do it. I don't do it as much as I should, but it definitely is a significant help to me. So
Mm.
that's what I do, I guess, at times to kind of stay as balanced as possible when you talk potentially work-life balance. But to me, like I said before in the show, like being a mom really has been my greatest achievement. So I was talking to my daughter recently. She was thinking about potentially like what career path and everything else, and she loves medicine. And for a second, she was thinking about cardiothoracic surgery. So she goes to me, "Mom, what kind of a mom would I be if I was a cardiothoracic surgeon?" I said,
Ooh,
"Oh, that's an interesting
interesting.
question." I'm like,
Sure.
"Well, what kind of a mom do you want to be?"
Right.
And she's like you." I'm like, "What does that mean?" She's like, "Well, you were always there for my like gymnastics practices and you for my meets and you were there for my dance competitions. You was there." And it's so funny, right? Because to me, I felt like I was the worst mom because I'm the one who was the last one to run in into those gymnastics
Mhm.
meets, and I'm always the mom that did not have enough pantyhose for her competitions and everything else, right? Like, I didn't have the mom swag for the
Right.
for the dance competitions of that nature, but she didn't see it that way. She
Mm.
saw it as me always being there, which was talk about a tear-jerking moment.
Mm.
Um,
Mm.
Definitely it. But to me, I guess the balance was always a matter of just being able to prioritize. And sometimes I did the right thing. Sometimes
Mm.
I didn't prioritize to the fullest, but I try to do my best. I think that's when people talk about potentially work-life balance or any kind of balance and anything else, it's just really making that conscious effort of absolutely doing your best. And if this is the best that you can do, and
Mm.
and the best is a matter of getting to the gymnastics practice literally the minute before they go on the stage, then that is the best that you can do.
Mm. You're very hard on yourself. I can see that. You are very hard on yourself. So, if you could now that you gave advice to your daughter, what would advice would you give to yourself as a young girl years ago? What would you say to them? To
Be a little gentle. Be a
Yeah.
little gentler on yourself. Um and delegate and ask people for help.
Mm, mm,
Ask people that you trust for help. And don't spread yourself too thin. You know, I was, I guess the people pleasing personality side of me and everything else, right? I was always fearful of saying no. You know, Evelina, we need this. Yes, yeah. I'd like before a sentence would be even finished, I would say yes, not knowing what in the world I just signed myself up for.
mm,
Truly, you know. And sometimes I still do the same thing. Evelina, we need you to. Oh, yes, sure, of course, I can do it. I'm not a problem. I can do it. I think learning the line of "Let me take a look at my schedule and get back to you" is something that I am trying to make my new mantra.
mm. You
You know?
have to though.
Yeah,
You have to.
in reference to but looking back, I think that's what I would tell my younger self, you know, try your best not to spread, yourself too thin, sleep more, sleep more because what I realize now is the fact that because I did not sleep enough and because I was so tired so often, I don't remember a lot of stuff.
Mhm.
I don't. Like, thank God for our pictures and our nonstop camera, easily available to us and everything else. I don't remember a lot of things because when you're so tired,
Yeah.
your brain doesn't have the capacity of storing it into your long-term memory box, right? And it makes me sad.
Yeah. Well, I think that's a lesson for all, certainly young people. And when you're in, it is truly all about the journey, right? So,
Mhm.
like, enjoy the moments as a young, doctor, when you're young in your
Yep.
career, and enjoy it when you're a young mom. I mean, all those times where you're just exhausted. I felt the same way. Like, I don't remember half the stuff, and it's a lot. And then we're hard on ourselves for that too. So, like,
So hard on myself. So hard on myself. I'm like, how did you not? And how do you not remember this? And how do you
right.
and I just don't.
Yeah, right. All right. Well, I want to talk about, before we go, your incredible new product, Electrolyte product. So tell us about that.
So it really all stemmed from, I guess, my daughter, who's a competitive dancer, who was a competitive dancer before she went away to school right now to college, and my pregnant patients. It all really started up. I'm incredibly close to the founder of Arizona Iced Tea Company, and 3 years ago, I think Kayla, my daughter, was in camp, and I had a hard time being without her. So they said, you know what? Why don't you just come by the house and spend some time with us and everything else? And it just happened to be during the summer, very hot weekend, and I was on call, and I kept on getting one phone call after another about patients with palpitations,
Yeah.
nonstop, nonstop. So I said, you know what, guys? Before dinner, because they asked me to stay for dinner. Before dinner, I'm just going to go see some of these patients because I promise you three quarter of them will be just dehydrated and that's it. So I left and I came back that evening for dinner and the co-founder and of Arizona Iced Tea looks at me and he's like, so was it true? Were they all dehydrated? I'm like, not all, but three-quarters of them definitely were. And then we started talking about potentially really working on a hydration pack, a hydration elixir, truly, that would be helping a lot of those patients. And more importantly, would be helping my own daughter. And this is why I feel so strongly about it because Kayla, being a competitive dancer who wouldn't drink enough, just like her mother, um, will get dizzy and lightheaded after competitions that are gruesome and long and everything else. And trying to get enough water into her. Like by the time that you're already thirsty and dizzy, you're way behind the eight ball when it comes to your hydration and everything else. And when it comes to hydration, it's very important. Like we always talk about potentially balanced nutrition, but we
Mhm.
don't talk about balanced hydration because that's incredibly important. So you can drink gallons and tons of water and everything else, but you can actually get yourself into trouble because if you're not repleting yourself appropriately with electrolytes, you can get yourself into a lot of trouble. So when Arizona came to me with this idea, I said I would do it with one specific rule. I get to be part of it from ground up. From the make of it to the taste of it to everything of it, because I need this to be safe, not only for the public. I need this to be safe for my own daughter. So and my patients that are pregnant and that are dehydrated during the time of the pregnancy and can't tolerate even water during the time of the pregnancy. And they said, okay. And that was the only reason that I felt comfortable really doing it. And I am beyond proud of this. I mean, honestly, we have three yummy flavors. We have mucho mango, which is my favorite. Right? It's called so
Gotcha.
the product is called RXMD, and it's really kind of corny because it has my picture in the back.
How great is that? That's amazing.
So yes, but we have mucho mango, we have watermelon and kiwi strawberry. And the beauty of it, and the reason why I wanted this is because of the fact that I wanted to make sure the fact that there are appropriate amount of electrolytes in it without getting anybody into trouble, to make sure the fact that there's no fake stuff. Like I can't tell you how much it would scare me when I would hear some of the other moms, they would be putting some of the other
Yeah.
hydration packs into their children's water. And I knew, because at that period of time, I was already studying all of these hydration packs that are on the market, what chemicals, true
Mm.
chemicals actually go in there. Like the sweetness here comes from real fruit. It's all real fruit. It's all real dried fruit, right? There's minuscule amount of sugar because it's just all
Mm.
natural. There's no dairy. There's no soy. There's nothing, um, you know, fake in it. It's sea salt, salt that actually gets appropriately absorbed into your body and with appropriate amount of sea salt. Because again, some of these products have so much salt in it that it could
Mm.
actually get some patients into tremendous amount of trouble with their high blood pressure, with heart failure and such and things of such nature. So, and and people don't know that.
Yep.
That's why I wanted to make sure the fact that everything was incredibly sort of really like I put my name specifically and my signature there because I wanted to make sure the fact that like everything was spelled out in reference to what is in the product. And I'm beyond I'm honored to work with somebody like the Arizona company. I mean, talk about potentially somebody who's humble and decent. I mean that they epitome like really they are the epitome of it. And I'm proud of it because now that especially now that my daughter is in college and she may want to go outside and have a drink or something, but I need her to make sure the fact that she stays as hydrated as possible and she has this with her at all times.
So let me say that. Where can people find it, get it? Where can they buy it?
It's on the Arizona website, but more importantly, it's on Amazon now,
Okay.
and it's in every single ShopRite in the entire country.
Oh my God, that's a pinch me moment. I mean, right?
I'm still like it's so funny, right? Because like once in a while I turn around and I see my own face. I'm like, what's happening there?
It's so exciting. I mean, it
But
really
it's
is.
incredibly exciting because you know what? I I never understood the complexity and the work that actually goes into it. Like if you only knew how many different tasting stuff we do. And then the way that it works is that, we sit at this monster round table with the biggest lazy Lucy right in front of it, right? Susie, right? Like lazy Susie,
Lazy
right?
Susan.
Lazy Susan, right? That's like, right, like and everything else.
Yeah.
And tiny small little cups diluted with every single thing. And Don Voltaggio, who is the founder of Arizona ISD, sits there and he has such a palate in reference to too much of this and too much of that, and it doesn't clear quickly enough, and it doesn't like, and it is just amazing. And I've learned how to appropriately appreciate it and to say what does too much magnesium taste like and what does too much potassium taste like. It is
Wow.
literally a skill that I never actually thought that I would acquire. But and it's so easy because it's a packet. You open it, you jump it into your water, you mix it, and because of the the way that the molecules of this product was that is that it mixes in immediately. So there's no like that grainy, yucky,
Hmm.
chalky, powdery feel and everything else. I am so proud of it and so proud of to be able to be part of this insane team that I
Oh
was a
my,
part.
that's huge. I mean, that's huge. I mean, maybe that's part of your, your next 5-year plan. Maybe you're supposed to be coming out with all these different products.
I think that this is definitely a big one, but I think my next 5 years, and it's a hard one to say, but I like the path of women's heart disease. I like the path of preventative cardiac disease. I last year I actually completed a certification in integrative therapy, so that I am uh, probably one of the first cardiologist that's actually trained in integrative medicine out there in the country at this moment,
Wow.
honestly. And because I genuinely do believe that before we get to the point of actually treating patients once they have a disease already and everything else, there's so much more that we can do with so many natural products that are out there to really support our bodies for preventative care. So, like they always say, like, put it out there in the universe. I'm putting it out there in the universe.
Oh my gosh, something's going to happen. Something magical is going to happen now. I believe in that. I 100%. I do believe in that. Oh my gosh.
Yes. Me
Oh my
too.
God. All right. So I think that's it for us. We have taken enough of her time. I don't know if you can have the night off or the day off, but you deserve it. Um,
Thanks.
I, I do want to say a big thank you to Dr. Evelina Grayver for sharing your story and highlighting the importance of women's heart health and how you got to where you are. And I think it's pretty awesome.
I really appreciate the opportunity, Jill. Really, I can't thank you enough.
Oh, thank you. All right. I'm Jill Conway. Thank you for listening to the show celebrating incredible women. I hope you're inspired to pursue your own goals, believe in yourself, and dream bigger. Your voice matters, and your story can help others. I hope you join me next time and share this podcast with a friend. And go buy that Electrolytes.
Absolutely.
Thanks, everybody.